On Tuesday we had a conversation about muscle spindle. I don't want to spend a lot of time on this again, just want to remind you, and pretty much I want to remind you and you want to remind me, what is its sense? What is the function of muscle spindle? What is the function of muscle spindle? What is its sense? The changes in muscle length. Okay, essentially when muscle becomes longer or muscle, it will sense it. Okay, when something stretches it. Correct? And another thing that I want to remind you, like a key thing, is that it has both afferent and efferent innervation, right? So you have sensory fibers, annular spiral endings, and flower spray endings, and you have motor fibers, gamma efferent, that go to the intrafusal muscle fibers, and alpha efferent that go to extrafusal. And just kind of few words: when muscle becomes stretched, rate of action potential increases, and we perceive it as the sensation of elongated muscle. Now it is time to chat about the stretch reflex, which isn't the only somatic reflex that exists in humans, but it's sort of a poster child of all reflexes. It's so easy to see how the reflexes work using the stretch reflex. So on the basic level, before we even start talking about it, can you remind me, what does the reflex arch look like? What do we start with? Any reflex arch? Sensory. What do we start reflex arch with? In your own words. Maybe not sensory, some other word. What do we start it with? Stimulus. Stimulus, sensation, anything. Okay, let's put stimulus. Now, stimulus is what type of signal? Is that sensory or motor signal? Stimulus. It's sensory, so it's sensory stimulus. Where does it go? I mean, what's going on afterwards? After the stimulus, what happens? Is there a signal? Yes. What kind of signal? There are only two types, sensory and motor. Sensory signal. What does it go through? Signals in the nervous system go through what? You know all of that, you just hesitate to say. I'm not going to take points away. Don't be afraid to say things. Signal goes through what? Sensory neuron. Where? In general. No, not yet. Don't focus on like very specific stuff too much. So you've got sensory input, you've got sensory signal going through the sensory neuron. Where does it go? What is the destination for the sensory input? Spinal cord. For reflexes, it's definitely spinal cord. What happens in the spinal cord? Using Cody's example, when he said, reflexes, when you touch something hot, you pull your arm away. Why do you pull your arm away? Because it's hot. So you've got some sensory input, and you produced what? A response, right? What kind of response that is? M word. Motor, right? So you have, at the end of this all, a motor response. What conveys the signal for the motor response? No. You just have spinal cord. Cortex is not involved. Motor what? What conveys? What transmits the signal? In the nervous system, what transmits the signal? What transmits the signal in the nervous system? In general. Which cells? Which cells transmit the signal in the nervous system? We're not going anywhere until you tell me. Which cells transmit the signal in the nervous system? Are you afraid you're going to embarrass yourself in front of your peers? Don't be afraid. What cells transmit signal? Cells. Don't look at the picture. It throws you off. Which cells transmit the signal? Huh? It's not a cell, it's a part of that cell. What's the cell? Neuron, right? It's a neuron. What neuron will transmit the motor signal? Motor neuron. We've got the reflex arch, right? So these are 5 elements. Stimulus, sensory neuron. Something is going on in the spinal cord. We'll figure out what's going on. Okay? It generates a response. Response is transmitted by motor neurons to the effector. Okay? In the effector. Before we move on, does that make sense? You've got stimulus, you've got sensory neuron that transmits the signal to the spinal cord, and then you've got motor neuron which transmits the motor output to the effector. Does it make sense? Everybody understands it. If not, tell me now. Are we good? It's really important that, this 5-element arch is clear. We're good. Okay. So stretch reflex. On the basic level, look at this. You have this muscle on top. Can you see it? I just circled it. We're going to call it an agonist. Okay, agonist muscle. When you stretch this muscle, what happens to the rate of action potentials that are transmitted from the muscle spindle? Increases, right? So that increased rate of action potentials serves as a signal. Are we clear? The signal is transmitted by sensory neuron to the horn of the spinal cord. Which horn of the spinal cord is responsible for sensory signals? Dorsal horn, right? So the sensory signal arrives to the dorsal horn. Can you see that arrival here? Okay? Bless you. So far, do you keep up with it? This sensory neuron forms 2 synapses. First, right here, that is shown as plus, is the synapse directly with the motor neuron that's shown in red. Can you see that motor neuron? So sensory neuron directly synapses with motor neuron. Where does this motor neuron go? To the agonist muscle. Now, before we move on, think about this for a second. Agonist muscle is stretched, signal goes to the spinal cord, and motor output goes back to the same stretched muscle. Red line on this picture, the one with where I put my arrow, this is not just the motor output. That's the motor output and motor neuron that goes to the agonist muscle, the muscle that is stretched. Is that clear? Good. Now think about this. Muscle is stretched from the standpoint of basic negative feedback. What would be the proper response to the muscle stretch? How can you shorten it back? Contract it, right? That will be the response of agonist muscle. Does that make sense? Now, in human body, there are many pairs of agonist and antagonist muscles. Whatever agonist muscle does, antagonist muscle undoes. Can you give me an example of agonist and antagonist muscles? You don't have to name them, just show them. Yes, so biceps brachii flexes the elbow, triceps extends the elbow. These are antagonist muscles. Does that make sense? Anterior muscles of the femur extend the knee, dorsal muscles of the femoral region flex the knee. Does that make sense? These are antagonistic muscles. These are antagonistic muscles. Is that clear? Now, think about this. If muscle contracts, agonist muscle contracts, can antagonist muscle block this contraction, contract it? Yes, it can. That's its function. Do you want it to be counteracted? You do not want it. How can you prevent antagonist muscle from working against the contraction? Say again? Think about this. I don't have my beating stick, but imagine that we have a rope between you and me, okay? And now, James starts to pull the rope. How can we make sure that rope goes all the way to him? Well, I'm not going to push the rope, it's not solid. But what I shouldn't do, I shouldn't pull. I should be totally relaxed. Does that make sense? So antagonistic muscle should be totally relaxed. Do you understand this? So there is a second output. You see the blue, dark blue neuron? This is another motor neuron that goes to antagonist muscle. And it inhibits it. Does that make sense? Antagonistic muscle. It relaxes it. Let me go over it again. I try to run the notebook so you can draw like at the piece of paper. You can if you have an extra piece of paper, it would be nice to draw it with me. Okay? On any free space. If you need piece of paper, let me see, maybe I have some. Yay! If you need some, grab some. Seriously. Yes, go ahead. Your question? Like you do this? Well, not necessarily. No, it's a movement. It's a conscious movement. We talk about the reflex. Do you see the difference? Because this is unconscious movement. So let's draw it. What does the stretch reflex start with? Stimulus to what kind of stimulus? Say again? Stretch. Of. Yeah, go ahead, grab the piece of paper. Agonist muscle. Everybody agrees with that. Are we clear on that? Awesome. What happens to the motor signal? So this arrow represents what? Motor, which anatomical structure? Motor, which cell? Motor neuron. Okay, where does the signal go? Say again? Dorsal horn. Of spinal cord. Does that make sense? Now there are two motor outputs, right? First motor output, I'm going to paint it blue if you don't mind. Actually, let's see if I can do something funny and say green. I don't know. Is it going to work or not? Okay. I don't really know. Okay. No, it's not working. Anyway, so that's one output. So, wait, what am I writing? Which motor neuron? It's sensory. Of course, sensory neuron. Does that make sense? Sensory neuron. My mistake. Correct me. Now, motor output. Where does it go? To the same agonist muscle, right? What kind of output is that? What does it do to the agonist muscle? Contraction. Does that make sense? And there is another signal. Now, there's another signal. Before we move on, I want to highlight something. Look at this. Can you see that? There's a little tiny green neuron. Any idea what it is? It's not motor, it's not sensory. What type of neuron that is? Interneuron. What is the function of interneuron? It's a signal integration, right? So if we want to switch to our notepad, you would have interneuron, right? And then there's going to be the motor output to what? Antagonist muscle. And what's going to happen to antagonist muscle? Relaxation. both motor neurons. Which structure of the spinal cord do they start from? Huh? Which one? Nope. That's dorsal. If it's not dorsal, ventral, right? That's fine. Okay. Does this process make sense to you? It's called from ventral horn. I apologize for the chicken scratch. Does this process make sense to you? If it doesn't, please tell me and we'll go over it one more time. Go over this one more time. Do you want to picture it again? Or we can go with the picture, that I have in the presentation. Huh? The picture's this one or this one? Okay. So what do we start with? Stimulus. It's a stretch, right? Does that make sense? So this stimulus generates what kind of signal? Sensory signal, which goes through sensory neuron to where? Dorsal horn of the spinal cord. From the dorsal horn, it goes through the dorsal horn to the ventral horn. What happens in the ventral horn? Motor output. So one output, direct synapse with motor neuron, which goes to where? Same stretched muscle and does what to it? Contracts it. Is that clear? Is that good? Another response goes through the interneuron, which synapses with another motor neuron, and this another second motor neuron goes to antagonist muscle, which relaxes. This relaxation calls reciprocal inhibition. I lost my glasses. Okay, question. Inhibition only. Inhibition of antagonist muscle is called reciprocal inhibition. Only inhibition of antagonist muscle. Go ahead. Relaxation of, no. Let me show. So blue is the sensory neuron. You see that synapses are in the ventral horn. All synapses are in the ventral horn. Whether it's the contraction and motor output and contraction of the agonist muscle, or motor output to and relaxation of antagonist muscle. Both of them go through the ventral horn. Can you tell me so there are two reflex arches here. One reflex arch goes from agonist muscle back to agonist muscle. Another reflex arch goes from the agonist muscle to antagonist muscle. Which one is monosynaptic? Which one is polysynaptic? Agonist is the monosynaptic because sensory neuron and motor neuron synapse directly. There's single synapse. And therefore, the inhibitory reflex to the antagonist muscle, reciprocal inhibition, is polysynaptic. Does that make sense? To solidify this, I'm going to do something that you all hate with all your guts. I'm going to call you and you will tell me, like, one person at a time, step by step, okay? The reflex arch. If you stuck, somebody will help you. Does that make sense? Don't hesitate. You don't have to stand up. We're going to start with Alexis. What do we start stretch reflex with? Okay. Speak up so everybody can hear you. Good. What happens afterward, Cody? Through? Okay, easy. Which part of the spinal cord it goes to? Can anybody help? Dorsal horn. We good? Okay? Is that understood? What happens in the spinal cord? Holly. They do. But like those sensory neurons, what do they synapse with? Jessica. Okay, what do they synapse with? Yes. Sensory neuron synapse with motor neuron. Okay. That motor neuron, Angelina, what does it do? Stop. Page. And what does it do to agonist muscle? It sends the contraction stimulus to the agonist muscle. Does that make sense? In the meantime, Jamie, there's another synapse of sensory neuron. With what? The green thingy. The green thingy, what it is? Interneuron. Interneuron, okay? And then interneuron synapses with Kelsey. Synapses in the ventral horn with what? Another motor neuron. And James, what does this motor neuron do? Antagonist muscle. And Kristen, what happens to antagonist muscle? It relaxes. You got it? The best way to sort of practice it is to tell it. Seriously, it's one of the concepts. You have to spell it out. It's not memorization, it's spelling it out, saying it to yourself, to somebody else. You can do like you know, a duo and just tell it step by step to each other. Does that make sense? Question. Holly, Jessica, what's up? You mean the reciprocal inhibition and perfect questions? Absolutely, simultaneously, at the same time. They happen at the same time. I have only one mouth, so I cannot say two things at the same time. That's the reason. Does that make sense? But they happen at the same time. Because muscle contracts and antagonist muscle relaxes at the same time. Now, this was the sort of a generic stretch reflex. Before we move on to knee-jerk reflex, any questions on this generic reflex arch? Knee-jerk reflex. When you go to the doctor, you know, you sit down and he taps on your knee, right? And your foot or lower leg jerks up. And if it doesn't, doctor tells you, congratulations, you have neurosyphilis. So knee-jerk reflex is an example of stretch reflex. Look what's going on. First, you have this little hammer that taps on your patellar ligament. I don't have Marvin or Melvin close to me, but patella is the kneecap. So it's right under the kneecap. Okay? Here. And when the hammer taps on that ligament stretches, and it also stretches quads, extensors of the knee. Does that make sense? Huh? That's the stimulus, stretch of the quads. These muscles, right? When quads stretch, the signal goes into all that you just saw, into the dorsal horn of the spinal cord, and that sensory neuron that goes there, synapses first with a motor neuron, the red one. And this motor neuron, what does it do? It goes back to the agonist muscle and stimulates what? Contraction. When your quads contract, what happens to your knee? It extends, right? I mean, it doesn't extend like this. You don't kick the doctor. But it jerks a little bit. Does that make sense? At the same time, by the polysynaptic arch, the inhibitory signal goes to the hamstrings, which are flexors, and flexors are relaxed. Your hamstrings are relaxed. Does that make sense? Now, before we move to the clinical significance of reflex like that, sensory neurons, motor neurons, which anatomical structures do they go through? Which anatomical structures extend between spinal cord and a muscle? Huh? Well, a bunch of neurons. How do we call a bunch of neurons? A bunch of neuronal axons. Let's put it this way. Huh? What is that? A bunch of axons. A bunch of fascicles? A nerve, right? So, come on, you're overthinking. You're trying too hard. No, it's much simpler than that, okay? So, you've got sensory fibers of the spinal nerve and motor fibers of the spinal nerve. Does that make sense? If something is wrong with the spinal nerve, what's going to happen to knee jerk reflex? It's not going to be proper. If something is wrong with the spinal cord, what's going to happen to the knee jerk reflex? Something's going to be wrong with that. Does that make sense? Now think about this. If you have a certain response, like a little bit of jerking, what can be abnormal? So nothing at all or a lot. Everything in physiology, you know. What's abnormal? Too little or too much? So if it's too little, the absence of knee-jerk reflex. Often neuronal damage in diabetes or neurosyphilis. Well, obviously, you know, coma, but usually you don't need to check knee-jerk reflex to figure out that a person is in coma. Although sometimes you have to. Maybe it's really deep lethargic sleep. Maybe it's, you know, the problem with reticular formation. Does that make sense? Okay? The opposite, stroke. In the stroke, if the inhibitory effects of the corticospinal tract are absent, then instead of a little jerk, it's going to be a massive jerk. In kids, in really little kids, knee-jerk reflex may be absent. It's normal because the myelination of the nerves in little kids doesn't complete until like 1 year of age, and actually it goes farther than that. So like several years of age. Does that make sense? So it doesn't necessarily mean neurosyphilis or diabetes in 1 year old. Okay? Well, it can happen. Yes, of course. Congenital syphilis can. Do you understand the idea of knee-jerk reflex? It's just typical stretch. Okay? Now, why stretch reflex is, what is the functional importance? The thing is, muscle spindle can be adjusted. The sensitivity of muscle spindle. Think about this. Remember, there are two fibers, annular spiral and flower spray endings, right? Annular spiral can sense the degree of stretch and the rate. Flower spray, the degree. Okay? But the point is, as any sensory receptor, muscle spindle has a sensitivity limit. There is a certain stretch when it starts to signal. Do you understand this? So that limit can be adjusted, like with hearing. You know, some people have really great hearing and they hear everything. Some people have less of it and, you know, they kind of partially deaf. Different sensitivity. Does that make sense? Same goes with the stretch reflex. Sensitivity can be adjusted via the practice, via the stretching, that kind of stuff. Think about this. Great degree of sensitivity, enhanced sensitivity, helps people that, say, practice gymnastics to exercise those, you know, complex movements on the beam, you know, balance, all that stuff. Make sense? Now the interesting thing of the stretch reflex, what is the word when, you know, when people kind of slide down and their legs go sideways?
Straddle.
Huh? Straddle? Yeah, yeah. Can anybody do it right now? Well, awesome. One person in the entire class. Does anything anatomically prevent you from doing this? Anatomically. Like some sort of like strap. No. You can do it. Anatomically, you can just straddle. I mean, you can, but anatomically you should be able to. The thing is, when you try to do that, muscles stretch and constrict. By practicing, you decrease the sensitivity of muscle spindles. Does that make sense? So you go lower and lower and stretch them farther and farther and farther, and they don't contract. Does that make sense? And eventually people can do that. One of the great examples of decreased sensitivity of stretch reflex are the pitchers in a baseball. If you ever saw well, I bet you saw pitchers throwing. Even I saw pitchers throwing. It took me 9 and a change years before I first attended the actual baseball game. The movement that they produce is absolutely unnatural. And the amplitude of this movement is huge, right? Normal person, if the normal person would try to pull off something like that, rotator cuffs will be totally torn immediately. And that's the common trauma of pitchers. So when they practice pitching, the sensitivity of the stretch reflex decreases and they can produce this huge amplitude of a movement, but at the price of tearing the muscles. Because essentially, the stretch reflex is the protective response. Does that make sense? Do you see what I'm saying? So, great precision comes with higher sensitivity, lower threshold of activation. Great amplitude comes with the lower sensitivity and higher threshold of activation. Does that make sense? Now, that is one reflex. That is the stretch reflex. Tendon reflex. Tendon reflex. Now, this should be easier. Okay? So, tendon organ senses the muscle tension. Okay? It's also protective. Tendon organ is located in the muscle tendon, and when muscle is substantially stretched, it has higher activation level, higher activation threshold. When the muscle is stretched a lot, signal goes to the spinal cord. Does that make sense so far? Nothing changes. Okay? However, this time, it's not a small stretch. It's a huge stretch. Potentially very damaging stretch. Do you follow me? So the response, and those two arches here, they both polysynaptic. The response is going to the muscle that's substantially stretched, the agonist, and the muscle opposite to it, antagonist. Do you follow me so far? We didn't mention what the response, the motor output is going to be. Now, if agonist muscle is already stretched a lot, and you will contract it, what's going to happen to the muscle? I'm talking about agonist yet. Wait. We'll wait till antagonist. If your agonist is stretched, and you contract it on top of that, what's going to happen to agonist muscle? It'll rip. Do you understand why? No? Yeah, well, imagine that there's a rubber band, okay? And you pull on your end, and I pull on mine, so it's already stretched. So that's stretching of a muscle. And then on top of that, so your end is a tendon and my end is the muscle, okay? So we stretched it, and then on top of that, I do the contraction, so I pull it back. Does that make sense? What's going to happen to the muscle? It's going to break. Do we want to contract agonist muscle? We do not. So imagine there's a tension, okay? You're tendon, I'm muscle. What do you want muscle to do to relieve the tension, that extreme tension? Huh? Relax. Does that make sense? In case of tendon reflex, the output to agonist muscle is inhibition. Does that make sense? The red line is inhibition. And output to the antagonist muscle is contraction, opposite, to help relieve the tension. Does that make sense? So this is called reciprocal activation. Does that make sense? Okay, let me do the drawing of the tendon reflex again. Okay? You ready? If anyone needs a piece of paper, go ahead and grab it. So I've got agonist muscle, right? What is the stimulus? Not just stretch. Huge stretch, right? Now, this stimulus, sensory input, through the huge stretch, is transmitted through what? Through which cell? Signal is transmitted, huh? Neuron. Which type of neuron? Sensory neuron. To where? Huh? Dorsal horn of the spinal cord. Okay? Question? Dorsal horn of the spinal cord. Sorry for acronyms, it's just easier for me to not write the whole thing down. Okay? Does that make sense? And then there are two synapses. So we've got ventral horn, right? Those black lines. What are they? Interneurons. Does that make sense? And the motor output from interneurons, where does it go? Through the motor neurons to where? First agonist. What is the signal? You don't have to raise your hand. Huh? Inhibition, which means in terms of the muscle activity. Contraction, huh? Relaxation. Jacques, question? Yeah, those are just ventral horn. I'm just saying that that's all ventral horn. They're just, sorry. You see just two interneurons. Yes. Two green ones. Okay. That's the only reason why I put two ventral horn things there. And the red and blue on this picture are motor neurons. So let's go back to that picture. So that's one motor neuron, okay? And the signal that it conveys is inhibition / relaxation. Does that make sense? What is another output? To the antagonist muscle. And what is the signal? Activation or contraction, right? Does that make sense to you? Okay? It's all recorded. Not that I'm telling, oh, let's move on. Just, it's all on YouTube. Well, will be. Is that understood? That's protective reflex, obviously. Okay? Protects muscles. And that's actually, you can observe it sometimes when you try to lift huge load. Okay? Your muscles getting stretched. And at the same time, you try to contract them to lift something. When they get this threshold of tension, you just drop the load. You cannot do that anymore. Okay? Because it's just too painful. I'm sorry about this. It's on some calendar reminder. Does that make sense? Question? Go ahead.
It's my fault because I came late. I'm trying to differentiate between the protection of the tendon reflex and the stretch reflex.
Mm-hmm.
I'm trying to differentiate between
level of tension. It's a level of tension. Muscle spindle is always lower threshold. Okay? So when there is a little bit of a stretch, muscle spindle will compensate it by contracting the muscle and relieving the stretch. But if stretch is too high, contraction will damage the muscle. And in this case, it's better to relax it, so that's going to be tendon reflex. In combination, stretch reflex and tendon reflex all together is why we move smoothly. Okay, contractions do not just abruptly start and abruptly stop. Okay, they transition between contractions of different muscles, happen in a smooth manner, partially due to this tendon and stretch reflexes. Just the threshold of activation different. Okay? This is one of my favorite reflexes. It's the flexor crossed-extensor reflex. Sometimes they separate it. Flexor reflex, crossed-extensor one. I prefer to talk about them all together. So this one shows the response if somebody grabs your arm. Okay? So that's what we start with. Somebody grabs your arm. Do you get sensory input from it? Sure. So that sensory input, you see the blue neuron, okay? It goes to the dorsal horn and synapses with the interneuron. Does that make sense so far? Now, in real life, if somebody grabs your arm, what is your response? Show it. This, right? Which muscles work when you do this? Biceps, right? Flexors. Flexors of an elbow. Does that make sense? If they contract, is that activation or inhibition? Activation. Does it make sense? This red neuron right here represents the activation. Now, if you flex your arm, what do you need to do with extensors? Relax them. This violet line represents the reciprocal inhibition of extensors. Does that make sense? On that notepad? Sure. Okay, so let's write it down. So that's going to be sensory input, right? This one that goes to flexors. What kind of signal does it transmit? Activation or inhibition? Activation. And the black one? Huh? This one. I mean the violet neuron and the black arrow. Huh? Inhibition. Angelina, is that better? Awesome. Do you understand this part? That's your response. So that sensory input produces two motor outputs. Activation of the flexor and inhibition of the extensor. Reciprocal inhibition of the extensor. Does that make sense? Often, together with this, what do you do with a fender? Push away. This movement, the movement of the elbow, what is that? Extension, right? That's extension of an elbow. Does that make sense? So if it's an extension of an elbow, which muscles do you need to stimulate? Extensors. And which ones do you need to inhibit? Flexors. Sorry, I should have inhibition. Okay. Does that make sense? Oh, on the left side? Oh, on the right. No, no. Can you help me? Can you help me? So that okay. Grab my left arm. Okay. So my response would be flexion, So flexors on the left side are activated, extensors are inhibited. And extension. So extensors on the right side are stimulated, flexors are inhibited. Thank you. Does that make sense? Now, can you remind me what is ipsilateral and contralateral? Ipsilateral, same side. Contralateral, opposite side. Opposite. So my left limbs are ipsilateral, my arms are contralateral. Does that make sense? Now let's spell out the activation and inhibition in this case. Stimulus, which is grabbing an arm, will activate which flexors? Ipsilateral or contralateral? Stimulus will activate ipsilateral flexors and contralateral extensors. Does that make sense? Look at me again. My watch is grabbing my arm, okay? It activates my ipsilateral flexors and contralateral extensors. Does that make sense? And it inhibits my ipsilateral extensors and my contralateral flexors. Does it make sense? No, okay. You want a little bit more talk about it? Alexis, can you grab Kristen by an arm? Please, thank you. Now, Kristen, can you show your ipsilateral flexor to everybody? Ipsilateral flexor, yes, thank you. Can you show the contralateral, well, you can't show contralateral flexor. Okay, where's your contralateral flexor? Shake it. Yeah, right here, yeah. Flexor on the left arm. Does that make sense? You have to be able to operate in ipsilateral, contralateral. Does that make sense? If you have troubles, tell me now. Okay? Or corner me afterwards, but tell me if you have troubles with ipsilateral, contralateral. Because I told you before, you have to know what we covered before. We covered ipsilateral, contralateral. I'm going to use that terminology. Does that make sense? Now, maybe I will provide better example. I don't know, maybe it's going to be easier. I'm stepping with my right foot. I'm going to try to pull off really risky business. I'm going to try and climb the bench. Okay. And I'm afraid of height, horribly. That's too high for me. So I'm stepping with my right foot on the nail. What am I doing? What I should do if I step on the nail? Okay, I do this, right? Which muscle is activated? The flexor, right? Oh, no. Yes, the flexor, the back of my leg, right? The flexor, the hamstring. My body weight, where is that? On the left leg. So which muscle is activated? The extensor, right? I can pretty much feel it. Does that make sense? So I activate my flexor on the same side and extensor on the opposite side. Make sense? Now imagine we doing some sort of a stupid bet that I can step on the nail and stay calm. Can I do that? I can. So this reflex can be overridden consciously. Like, my favorite example is Die Hard movie, when Bruce Willis runs on the broken glass. It probably hurts. So I mean, the immediate response is to do this, but he kind of says, well, I got to do what I got to do, and walks in. Does that make sense? So that's the idea. You have to think, these two examples, pulling the arm and pushing somebody away and stepping on something sharp, should give you sort of a perception of which muscles are activated, which muscles are inhibited. Does that make sense? Good? Okay. All right. Other reflexes, so-called superficial reflexes. Now, there are plenty of them. There are. Plantar. It's a pretty common reflex, often used to check the integrity of the lower spinal nerves and lower parts of the spinal cord. Often used in kids. Okay? So plantar reflex, normally, if you use the blunt tool and you draw it along the lateral aspect, you cannot see the lateral aspect of your sole, okay, of a plantar surface. The toes will curl like this. So if this is a toe and you draw it here, it will do this. And that's a normal response. This is called plantar reflex. In children, instead of in babies, yes, well, up to 1-2 years of age, so at like 2 months, I call them zucchinis, they don't do plantar reflex. They do Babinski sign. Their toes fan out. And that's normal for babies, because the myelination of the spinal nerves isn't complete yet. Signal transmission isn't perfect yet. Hence the response. Does that make sense? So, like, it's normal in babies, it's abnormal in adults. Damage to either the spinal cord or most likely spinal nerves. Okay? Abdominal reflex. It's kind of funny. So you stroke the abdomen towards the midline, and like if you stroke in the upper part, middle part, lower part, the umbilicus, the belly button, should move towards the stroking finger. That makes sense. I mean, it doesn't mean that, like, if I start to stroke from here, the belly button just moves all the way to the right. No. You will see, like, twitching. Does that make sense? And that depends on where you stroke. It will change the integrity of different parts of the spinal cord. Okay, if it's hypogastric area or, hypochondriac, it's 5 to 8 thoracic. If it's umbilical, it's 9 to 10. And if it's iliac, then 10, 11, 12. There's another reflex that is often used to check the integrity of genitofemoral nerve. I probably told before. If you do the stroke towards the medial aspect of the femur, like pretty much here, if you stroke this way, then the ipsilateral testicle should be pulled up. It's often called testicular cremasteric reflex. There are many reflexes. All of them are to check the integrity of the spinal cord and the spinal nerve. Okay, does that make sense? In terms of what you should know, stretch, well, knee jerk. Knee jerk and stretch are pretty much the same. Tendon reflex, flexor crossed-extensor, know them. Okay? By the way, one thing that I didn't mention about flexor crossed-extensor, kind of is shown in the picture, just didn't, point your attention to it. Can you see that neuron, the green neuron, interneuron right here? You see it goes to the opposite side of the spinal cord. It crosses to the opposite side. It kind of, to show how it goes to the opposite side. Does that make sense? It goes through the Great Commission. So tendon reflex, stretch reflex, flexor crossed-extensor. Babinski sign and the abdominal reflexes, understand which regions of the spinal cord are checked. Like Babinski, lumbar, lower lumbar, sacral. Abdominal, thoracic. Abdominal reflexes, thoracic. Anatomy part, no. Anatomy part is going to be pretty much restricted to the cranial and spinal nerves. That's it. Does that make sense? Any questions before we take a break? Go ahead. L4, S2. So lower lumbar, upper sacral. We good? Let's take a break. And I'm going to put the quiz for this chapter down there. Take it whenever you want. Okay? And we'll talk about some other stuff when we'll come back.